The American Lung Association just released its report on the state of lung cancer. In Pennsylvania, the rate of new cases is significantly higher than the national rate. But it's not all bad news. The survival rate and screening numbers are actually above average. Still, the group says the Commonwealth has a lot more work to do to make sure that those at high risk are getting screened. I'm here right now with Ryan Levy, a doctor with the UPMC Division of Thoracic Surgery, to talk more about Lung Cancer Awareness Month. Thank you for joining us today.
Thanks for having me.
So let's talk first about the causes of lung cancer, because I think there's a lot of misconceptions about how this might happen.
Yeah, I mean, the vast majority of lung cancer patients are smokers. About 80% will have a smoking history, but we have 20% of our patients that have new diagnoses of lung cancer that have no smoking history. And their risk factors might be familial, some of them might be secondhand smoke exposure, some of them may be environmental, pollutants, people that are exposed to certain chemicals or agents at work. Radon is really high on the list, as is asbestos exposure as well.
Now, is that something that would influence the rates that we're seeing in Pennsylvania as a whole?
Well, we have a lot of long history in Western Pennsylvania in particular of steel workers and mine workers and people that are industrial workers, and all of those exposures would increase the risk as well.
So are there different types of lung cancer?
There are. The vast majority, 75% of lung cancers that we see would be non-small cell lung cancers.
Okay.
A smaller percentage, about 20% or so, will be small cell lung cancers. Those are the majority of the time not treated surgically. And then a very small percentage of lung cancer patients will have a more rare form of lung cancer called carcinoid tumors.
Dr. Levy, talk about detection and when screening should begin. I mean, is there symptoms that you should be looking out for?
Yeah, I think that's really the key question, and the problem, and what all of us in lung cancer care are working towards, is earlier detection, because if we wait until symptoms develop, often the disease is advanced and a large percent of patients will be incurable. So we really want to try to identify patients with lung cancer at early stages, and that's where screening and early detection comes in. So American Cancer Society actually just recently updated their screening guidelines. If you're anyone over the age of 50 who has smoked for 20 years and is either a current smoker or has quit within 15 years, is eligible, and that would be with a low dose screening CT scan. So
I know sometimes you mentioned smokers being at the top rate of those who are diagnosed. Oftentimes smokers can have other conditions, emphysema, COPD. Does that make them at higher risk for lung cancers, or?
Interestingly, not necessarily. I mean, most emphysema and COPD patients are smokers. There's a percentage of people that do develop emphysema and COPD that do so for other reasons, but that doesn't typically increase the risk of lung cancer.
And what about options for treatment and surgery, that sort of thing?
Yeah, I mean, the key with, as we talked about with screening and early detection, is we want to diagnose cancers early. So if someone has an early stage lung cancer that's localized, that has not spread beyond the chest, then often they would be a candidate for a surgical resection if they're deemed medically fit. More advanced stages of lung cancer, where we're talking about tumors that have spread to lymph nodes, tumors that have spread beyond the chest to other organs, bones, liver, brain, those would be patients that would often need a non-surgical pathway.
What are some of the symptoms? I mean, if you have waited past the point of early detection, what are some of the symptoms that you might see with lung cancer? Yeah,
I mean, there's an acronym that the American Cancer Society and Lung Cancer Society use called BREATHE, and a lot of the symptoms are things like bloody mucus or rust-colored mucus, shortness of breath, cough or noisy breathing, weight loss, sort of loss of appetite, headaches, bone aches. All of those can be sort of subtle symptoms of a lung cancer.
Okay. Thank you so much, Dr. Levy, for coming on and educating us a little bit about what's happening with lung cancer.
Thanks again for having us, and again, please get your lung cancer screening if you're eligible.
If you are eligible, thank you. And for more information about Lung Cancer Awareness Month and programs at UPMC, we will have a link on our website at kdka.com/talkpittsburgh. We'll be right back.